Hey guys, so I'm sorry we couldn't have class today. The weather is absolutely insane. It's supposed to be spring, but I guess not. So what we're going to do today is a lecture video instead, and we're going to do a discussion board so that way you don't lose points. After you watch this lecture video, make sure you view PowerPoint with me along as we go through the lecture video. And then post in the discussion board. Make sure you do one main post and then do a response to a classmate. Your post should be in-depth and thoughtful. It should be just like a class discussion. Share your thoughts, your feelings, your ideas, your views, your values. Whatever it is that you want to share that you would normally share in class, I want you to share it there. View it as a way to participate in class with each other. So, as we get started, I really like to do this in person. But obviously we don't really have the opportunity. If I get to, then we might switch out, but today we'll just talk about infectious diseases. So first of all, what is an infectious disease? A disease that is transmissible from one person to another person through direct or indirect contact. So what in the world does that mean? So infections are caused by pathogens that get in the body through various different systems, and we'll talk about that briefly in just a second. So pathogens are the sources that cause disease that can be passed from one person to another. They can be passed through different things, and they can also be of different magnitude. So you have the variance in pathogen virulence, which is the severe symptoms that could be caused by the pathogen. You have the differentiation between skin and bloodstream pathogens. Obviously, bloodstream pathogen is going to be a lot different, than a skin pathogen. And then how much are you exposed to the pathogen? Were you around somebody that whole time? Were you exposed to radiation constantly? What was your exposure? That's going to depend a lot on your symptoms. Then we have the cycle of infection, which is the source of pathogens and which it comes from. Are you a susceptible host? So is your immune system down? Are you in an environment that's hospitable to pathogens? And the mode of transmission, so is it orally? Is it bloodstream? How were you infected? That's a very big thing with infectious diseases. So, the body's defense mechanisms to pathogens is outstanding, and I am always amazed at what the body can do. So, our built-in defense mechanisms to pathogens are our skin. Obviously, our skin protects us from a lot of things. Mucous membrane traps, which traps pathogens. So our mouth is a trap. It opens and closes so things don't get in, hopefully, unless you're just sitting there in class, like, then you're letting things in. Nostrils, so our nostril hairs actually help trap pathogens. The hair isn't there for nothing. Our eyelids, which open and close, we can get mucus exposure through our eyes. So if somebody sneezes, we can get water droplets in our eyes, which is why our eyelids help control that. Our lungs are also a good defense mechanism, and our genitals have a good defense mechanism. The hair also helps trap things. Most of the time, for women, you can open and close it. It's not just open all the time. So that helps, and then we also have chemical barriers that help protect us as well. Our immune system is also a very good protector, which is a network made up of organs, tissues, and cells that respond to a defense mechanism or disease-causing agent like a pathogen. So the body has a very good way of sensing whenever pathogens are in the body. So the best way I know how to describe your immune system is immune cells constantly circulate throughout the body to recognize foreign substances and take action. They take action. Antigens are recognized as being foreign and trigger the immune response. And whenever the immune response is triggered, the immune system responds to the damage and toxins a pathogens process or produce. And so they move to the area and they eat the invading microbe. So typically pain or swelling that often result from the body battling some sort of infection that could be spreading. So the way I really like to view our immune system is like a police officer, or the police system is a police officer is patrolling the area for foreign substances or foreign beings that don't really belong, that don't belong there. Once they find them, then typically they mark them, so they get their little fingerprint or whatever else, or they take them to jail, put them in the car, and they deal with them that way. So I view it as like a little police system where somebody's always going around trying to protect your body. The lymphatic system helps with fighting different types of pathogens. So our lymphatic system is made up of the spleen, thymus, bone marrow, and they all activate infection-fighting cells. So typically, if you see a part of your body that's swelling, that's your body telling you that that's where the area is that's infected. And that's amazing that our body can do that, that it can swell up and say, this is exactly where the infection is, this is what we need to deal with. So whenever I had mono, my lymph nodes right here swelled up super bad. So that was the body telling me that this is the area that's infected and we need to deal with this right now. We can't talk about infectious diseases without talking about immunizations. So vaccinations or vaccines are diluted or killed microorganisms of the disease that you're getting. So the flu shot is literally the flu, but it's a diluted or a different strain of the flu that they're putting in your body. So that way the body can recognize it and it can identify it right away if it comes in, and it can kill it. It's important for us to remember that no vaccine is completely effective. There is no such thing as a 100% effective vaccination. It does not happen. So let's keep that in mind whenever we're getting vaccines of any kind. Okay, so stages and patterns. Acute infections are infections that last for a short period of time. They typically come on really quickly, and they don't last for a very long period of time. You have different stages. So you have the incubation phase. That's the time that you were exposed to the infection. So maybe you were around somebody that was sneezing or coughing. And then the prodrome phase is where you see initial appearances. So maybe you start to sneeze and you think it's just allergies, so you don't think anything of it. And then the illness is the full-blown illness where you feel like crap, you don't want to go anywhere, you're blowing your nose all the time, whatever it may be. And then convalescence is where the symptoms have subsided, you're feeling a lot better, and the illness is leaving your body. And then we have acute infection, chronic infection, and latent infection. So we've already talked about acute infection. It happens rapidly but doesn't last very long. And then you have chronic infection, which is a prolonged infection that you can't get rid of. So chronic infection examples: hepatitis turns into chronic liver infection turns into cirrhosis, or things like HIV, which leads to AIDS. Things like that are chronic infections. And then latent infections are infections that lie dormant in the body for a period of time but may reoccur under certain circumstances. So chickenpox can lead to shingles. Mono is also a latent infection. Statistics on mono are outrageous, and you can also get it again in your lifetime if you've already had it. Prevention of infections is very important on a college campus. Hand washing is a very good way to prevent infection. Cover your mouth and nose, but don't cover it with your hand. So make sure you're using your arm or you're using a tissue that you can get rid of. Don't cough or sneeze in your hand like I just said. Use alcohol-based hand sanitizer and good self-care. So the number one way to prevent, or the number one way to spread, I should say, would be airborne droplets on college campuses, which means that somebody's sneezing and they're not covering their mouth. So that's the number one way that viruses get spread, is airborne water droplets. So make sure that you are covering your mouth, covering your nose, you're doing what you're supposed to do, and not infecting other people. Treatment of infectious diseases is antibiotics, which is to treat bacterial infections. If you have a viral infection, antibiotics will not work for a viral infection, and they will send you home with just over-the-counter medication. So if you have any type of viral infection, you really basically just have to write it out. And as frustrating as that is, because it's very frustrating for me because I don't get bacterial infections, I just get viral infections, we just have to write it out. So mono, which is a part of the Epstein-Barr virus, it's a member of the herpes family, which it really isn't herpes. It's transmitted through saliva most of the time. The big statistic on this is 90% of people have been infected by the age of 40, so that's 90% of people, and that's a large amount of people. Again, it's a latent infection, and the transmission of mono is nearly impossible to prevent. So you really just can't prevent mono. If you're going to get it, unfortunately, you're going to get it. And I was one of the lucky ones, and it's just fabulous. Meningitis is the inflammation of the meninges and the membranes that surround the brain and the spinal cord. So meningitis is really not something you should mess with. Anything in the brain you really need to look out for, and you need to make sure that you are trying to prevent it 100%. A viral infection is the most common type of meningitis. It typically resolves in 7 to 10 days. And then bacterial meningitis can lead to disability or even death. Typically, that means that you have some sort of bacteria in your bloodstream that spreads to your brain that causes massive swelling in your brain that leads to brain damage. Bacterial skin infection, so MRSA, which is a staph bacteria that is resistant to a lot of antibiotics. It's close skin-to-skin contact. It's typically you see like red abrasions on your arm that start to swell, and that's typically what MRSA looks like. It requires professional care. You have to go to the hospital. Antibiotics usually, sometimes they don't work with MRSA, so that's why you have to go to the hospital immediately, because sometimes the reaction to MRSA is not good. Okay, so now let's move into sexually transmitted diseases. So there's a big difference between STIs and STDs, first of all. So an STI is an infection that you can get rid of. An STD is a disease that you cannot get rid of. So STI, some stats for you. The most common infection in the United States is an STI. 20 million new cases each year between 15 and 24 years old. All STIs are preventable. You can prevent STIs. Women are at higher risk, so 1 in 5 women are at risk between the ages of 14 and 49 for genital herpes, and 1 in 9 men are at risk, so women have a higher risk. And in the absence of signs or symptoms, anyone who's sexually active can have an STI. You're going to find that during this lecture, STIs don't have a lot of signs and symptoms. So genital warts... Genital warts are, obviously, they're warts that go around the genital area. I apologize. They're warts that go around the genital area, so usually you'll find them at the head of the penis or around the penis. If you're following me on the PowerPoint, then you can clearly see that they are all around the head. Sometimes it causes massive swelling so that it swells up the head of the penis. You can also see that you can get warts on the outside of your vagina, so surrounding your pubic area. If you have genital warts as a female and you're pregnant, you can pass them on to your child through labor as well as breastfeeding. HPV, so human papillomavirus, is the most common STI in the United States. A lot of people think it's herpes, but it's really not. It's HPV. 30% of young women acquire HPV from their first sexual partner, and then within 3 years of being sexually active, 50% of women have been infected. So that's over half of the women in our room that could be infected from HPV. HPV treatment, so creams, lasers, freezing or burning. The virus does stay in the body, so you have to be careful with HPV because HPV can cause cancer. And there are vaccinations for both men and women that a lot of doctors suggest that you get, which is cervix or Gardasil. And I've heard that you get them before college now. It's like a requirement. I'm not really sure. Or it's recommended that you get them. I'm not sure how that goes. But they go in 3 rounds, 1 per month, I think. I have not personally had them, so I'm not really sure. I've heard that they're quite painful. And they do cause a lot of discomfort in women. With chlamydia, so chlamydia is typically a yellow discharge from either the penis or the vagina. You can tell by the way that it discharges. It's going to be like a milky substance. It's going to be not liquid or fluid. It's going to be more of I'm trying to figure out how to describe it. It's going to be more of a solid texture than a liquid texture. So chlamydia can be transmitted from vaginal or anal sex, and it can infect a baby if a mother's pregnant as well. 70% of cases of chlamydia do not have symptoms. So no symptoms for chlamydia other than the yellow discharge. And some other symptoms, pain while urinating or abnormal discharge. So again, that yellow discharge. The only way chlamydia can be treated is with antibiotics. And if you do not get chlamydia treated, then it leads to more severe STIs and STDs that can cause a lot of damage in your body. Gonorrhea is along the same lines as chlamydia. So again, you see that discharge. You can see that in the photos if you're following along with me. For women, symptoms can include, again, pain while you're urinating. Let me just stop and say that if you hurt while you're peeing, that's a very clear sign, ladies and gentlemen. And if it hurts while you're peeing, you need to go to the doctor as soon as possible. There's no doubt in my mind that if it hurts while you're peeing, you are in not a good place, and you need to see somebody regardless. Gonorrhea, again, symptoms for women. If you're bleeding between periods, pretty heavy, pain during sex, the discharge, or excessive bleeding during your period that's more than usual, you need to see somebody. With gonorrhea, you can get 25, so you can get it in your throat. 25% cases are in the throat. It can spread through contact, obviously, from vagina, penis, mouth, or anus. And then most women do not have symptoms of gonorrhea, so you need to be careful with that. Treatment for gonorrhea is antibiotics, so you need to go to the doctor to get treated again. Much like chlamydia, if you don't treat gonorrhea, then you wind up with something more severe, which causes a lot more damage, especially for women. Next is the pelvic inflammatory disease, and this is only for women. You could probably see why. So pelvic inflammatory disease is where one of the fallopian tubes is extremely inflamed, and it's extremely painful. If you look at the photo on slide 37, you'll see that that's a live fallopian tube that they have taken out because it was so inflamed. It deteriorated and destroyed the fallopian tube. So again, PID is infection of the fallopian tubes, uterus, ovaries, other reproductive organs in women. Like I was saying earlier, if you don't get chlamydia or gonorrhea treated, this is what happens. You get PID, which is not good. So symptoms of PID are extreme pain. It hurts to have sex. It hurts to pee, all sorts of things, a lot of bleeding or irregular bleeding. You can clearly see from the photos that it's going to be painful. It's not going to be fun. And if you have PID and you're lucky enough that you catch it in time, there won't be severe damage. But if you don't go to the doctor in time, sometimes they can damage the reproductive organs, which means that unfortunately you're going to have full hysterectomy, which means that you can't have kids. They're going to take out your uterus, your ovaries, your fallopian tubes. All of that fun stuff is going to go because you're at risk for other diseases at that point. And then moving on to syphilis. So syphilis can be found on your hands, your feet, your legs, or on your face. Typically, you find them on your hands, little bumps, little swelling. It's transmitted through infected skin and mucous membranes on the genitals, lips, or mouth. There's 3 different stages of syphilis. The first one is you find just a painless little sore. It doesn't hurt, doesn't itch. You don't think anything of it. The second one is it turns into a rash that doesn't itch. So again, you don't really think anything of it. And then third one, when you prolong it for, years. It takes years to decades for this to happen. People who have not been treated with syphilis, it goes to their organs, and their organs can shut down and they can die from that. And then genital herpes. So genital herpes typically means that you have blisters, and for men it means you have blisters right on top of the foreskin on the neck of the penis. And then for women,